Assuming I need hormone treatment, but thankfully, based upon your checklist, I'm doing well so far. If I do go in though, and I do have some concerns, and you begin a therapy with me, take us through that administration process. How are the hormones administered? How is that progress tracked over time? What can the patient expect?
Well, the first thing I would say is that hormone replacement therapy is never done as an isolated treatment. This would be doing a great disservice to any patients because the table I told you about, the support system, if that's not in place, any hormonal treatment will be undermined. So if you don't get your diet right, you don't sleep, your stress isn't under control, you're not exercising, your hormone replacement therapy will never be optimal for you. It's always going to be less than you had anticipated. So uh, I tend to look at this a little differently. I don't treat a lab test value. I treat a person. And when you treat a person, you have to look at the whole picture. We have a very complex, very sophisticated biology that's evolved to be extremely interdependent. So all of our human organism systems are very interdependent on each other. So if you start to just treat one little aspect, you're going to get yourself into trouble. You'll never get the same result. So we like to look at the whole picture. And in doing this, we're going to give you the best results. So it's not about, which hormone I'm going to put you on because of a lab test result. First of all, it's about your history, how you feel, what your issues are, what your lifestyle has been, and then looking at all the lab values. And there are other things that contribute to the expression of hormones. For example, toxicities. Okay, there are many toxicities that we're exposed to. There is, in addition to toxicities, we have allergies. We have things that allow us to absorb nutrients and things that prevent us from having optimal absorption of nutrients, such as what's going on in our gut and the health of our gut. It's the quality of our brain, because remember, above all else, the brain rules. It's number one. So if your brain is not functioning properly, if you have a deficiency of some of the neurotransmitters, such as serotonin or GABA or any of the other neurotransmitters, then you're going to have some issues that have to be addressed, and that's going to also influence everything else. So what I'm trying to explain is you need to look at the whole picture and then design the treatment based upon where the patient is and try and optimize everything you can. I describe it in this way. Basically, what you are, you got about 35% of it from your parents. And we can't do much about that right now. I mean, because gene engineering, it's not yet ready for prime time. Okay, we're not quite there. I mean, we're doing certain things with stem cells, etc., and that's another fascinating topic for another time and show. But right now, what we can do is we can understand that 65 to 70% of the influence is the environment. So you got 35%, that's your parents. The rest of it's the environment. That makes you. Now, what we can do is we can clean up the dirty soup that your genes are swimming in, because that's what has been happening to you since the first day you got out of the womb. You've been subject to a lot of these influences that have basically dirtied up this environment that your genes are swimming in and have caused the expression of these genes to be somewhat less than optimal. So what we're trying to do with anti-aging, and really the essence of anti-aging, is to optimize gene expression and make it as positive as possible. And the way you do that is through these various methods to clean up that dirty soup, to enhance and optimize the internal environment in your cells, in your body, that your genes are swimming in, to give you, I guess, the optimal chance and shot at, the most vital and, the best amount of vital life, optimal wellness, as well as the ability to stave off, to the extent possible,